SuperTalk TV. You can see I'm not alone in the studio. Got one of my favorites in the house now, Miss Christiane Williams. She is a mental health awareness facilitator, and she is the founder of Leading by Example, which is raising awareness for the shame of mental health, or I guess not raising awareness for the shame, but I guess in a way you are, because there is shame sort of around it. And with this being Mental Health Day, I thought, what better girl to get in the room to remind us that it matters and there's good resources and some genuinely good things going on in our state to sort of help combat this, or at least you can't really combat it without the person's willingness, but at least bringing light to it. So welcome back.
Yes, ma'am, Miss Rebecca.
What you been up to since the last time you've been here?
Well, I've kind of been around the world. I got to go to New York in August to represent the state at American Probation Parole. It was people from as far as Guam that was there, and all the territories of the United States. So it was over 1,500 of us that's in corrections that was there in New York. I participated in a women's symposium about women in the workplace, corrections. It was a great experience. And I got to meet Mississippi's own Robin Roberts.
Oh, there you go. Yeah, who's also been a big champion for mental health throughout her journeys and her career and all the things. Okay, so you and your Leading by Example, I know you go around and do so many of these. What are you hearing most in terms of your feedback? What are people connecting with and saying, yes, I struggle with this every day, or yes, this is in our departments? Like, what's the most common that folks can feel less alone about?
The most common they talk about depression, anxiety, and then feeling like they don't have anybody to talk to, or people just wouldn't understand. As far as the law enforcement area, typically we don't want to tell anybody because we're afraid of the repercussions. And it shouldn't be repercussions, somebody asking for help. A lot of times, you could be, some officers think their weapons will be taken from them. They'll be placed on desk duty. The stigma of the shame is placed on them. And that's just not law enforcement. That's throughout. Everywhere. People most times are ashamed to tell somebody, I need some help.
And too, it's that shame that comes within the family dynamic, especially between partners or spouses. It may feel like you don't want to open up and allow them to see, even though I'm sure the warning signs are already there. So, Christiane, where do you send folks when it comes to the resources that are in our state if you need somebody to talk to?
The first thing I tell them to do is dial 988. 988 is a call center, and it's throughout the state of Mississippi. It is live therapists that's here in our state. We're not dialing out. There's 2 call centers. They will walk you through whatever is going on. And if you need additional help, resources, they're going to refer you right over to, if it's Community Mental Health Center, one of the entries, point of entries, one of the hospitals in your area. So help is available. It's just a phone call away. Also, the Department of Mental Health has great resources, and then your local community mental health center. Utilize them. They're there. When people say, I don't have the money or the funding, they're going to help you. They're not going to turn you around. Go to your local community mental health center.
Which I think that's another big barrier for some folks who really do understand that maybe they're wrestling with something or been wrestling with it for a while. But there is this idea that to get that kind of treatment, a lot of insurance doesn't necessarily cover it, or you may not even know that your insurance would or wouldn't cover it. So you would think it's an out-of-pocket expense. You would rather just not wrestle with that. But there are so many free resources and opportunities out there that would meet your requirements.
Absolutely. And like I said, the community mental health center is your your first place that, locally that could assist you. 988, if you call them, they're going to refer you back. What we try to do is connect everything together. Your local community health center, 988, the Department of Mental Health, all of those are entities are connected together. So if you get in the circle, you should keep going around till you reach the help that you need.
So there's got to be warning signs or common signs of, I guess, mental illness versus mental health, I think, are 2 different things.
It is.
But so how do you help people describe maybe you're just in a funk because, you had a bad day at work, or, something unfortunate just didn't go your way, versus you've got a mental illness?
The pattern. If it continues to keep happening over and over, and you get, everybody have their days where you just like, oh, I don't want to be bothered. I heard him earlier say, you got to turn it off and turn.
Or you just wake up mad and you don't know why you mad, but you just woke up mad because you're a female and it just happens. It's like, I'm going to be mad at the world today for no other good reason than to be mad. Right. But it goes away.
Right. If that's a pattern and it's your pattern and everybody else is seeing it, it's probably time to go sit down and kind of describe something is going on. And, just recently I had a friend to call about something that was going on with a family, which was a child within the family, a family member. And we was, in deep conversation. And my words to them was, I'm not around that child. You are. If your instincts is telling you is something going on with this child, behavior, mental, go get it checked. And that's a lot of times, that's what we don't do because we don't want anybody to say, oh, it's something wrong with your child. We don't want anybody to outside to think it's something going on. But if we don't do the early intervention, then we run into when they get to teenagers or young adult, this is an untreated condition that could have easily been treated early on. And that's that
better
early
understanding.
That early intervention. Just not worrying about it. And I know it's easier said than done.
Absolutely.
Don't worry about what anybody say, but nobody want their child labeled.
No, and I think you can also make excuses for being withdrawn or if they went through a bad friendship or whatever, breakup or whatever. You can kind of tuck that under. But there are times when, as the adult or the caregiver, you should maybe pry a little more and then have them talk to a third party of some capacity, even if it's at your church or within somebody that you would trust. So with that, I mean, where would you take teenagers? Would it?
You can start at your primary physician,
your pediatrician.
Your pediatrician. Now, if you notice, I know they start to ask a little bit more mental questions. Some of them, how are you done? Sometimes they put the parents out, to get a true understanding of this child. Those are some of the things. And I was just watching the other day, always reading and watching, where they're asking like the American Medical Association to start in their intake more mental health questions with the patients. So if we hadn't seen it, we're going to start seeing it. If the doctor's asking us how we feeling physically, they're going to start asking the mental, what's going on with you mentally? Are you getting breaks? Are you stressed? Are you able to sleep? All of those things we will start being asked those questions also. So if you hadn't been asked that, get ready because it's coming. Because actually my doctor this year, when I went in for my yearly checkup, both of them asked those questions on two different occasions, even though I teach it. They didn't really know until I started smiling. They say, oh, and I said, oh, so it's coming down. And they was like, oh, are you testing us? And I just started laughing, but it really happened. So I read it and then it happened to me, so it's coming.
So what does that mean to you when you've had, and you and so many others have had their boots on the ground in the trenches here in Mississippi specifically, really trying to raise awareness and create these lifelines? What's it like when you finally walk into your doctor's office and you're asked that? Do you feel like a sense of
vindication, like, oh, wow, my work is not in vain? And I know it's not, and it's so much work, Rebecca, out here for a lot of us. That's why it's important. I don't have a problem about going to the churches. Like I told you at lunch, when you text me, I was actually at the church with a group of we call them senior saints, not senior citizens. And we that's one of the things we was talking about: healthy eating, lifestyles, your mental health. So that makes me feel really well, about what I'm doing, that I know people are starting to actually talk about mental health, just like high blood pressure, how many calories you're eating, diabetic, that is a conversation that's involved now.
Because it all plays a part. It all feeds each other. I mean, good diet and exercise help mental health, but you got to have good mental health to then put in the good, and sort of it's an ecosystem sort of there. You also reminded us too, no matter how young you are or no matter how old you are, your mental health matters. So check on those that are your wiser in years in your family, not just their blood pressure or whatnot. Check in and make sure they're still, feeling love, supported, seen,
absolutely,
and having that fellowship and connection that's needed so much. All right, Christiane, if we want to get you somewhere with one of your trainings, how do we get in touch with you?
You can call me. I'm on Facebook, Leading by Example MS, or you can dial me at 769 I forgot my own number. I don't never use it. 769-208-4142.
And if you are in a mental health crisis or you just need someone to talk to, don't forget 988 is the number to put in your phone and to know, use, and share that number as well. All right, stick with us. We got more for us coming up.